Thank you, sir. I am audible?
Yes, you
Yeah.
are.
So, um, my topic for presentation is use of artificial intelligence in cardio imaging and COVID. And as Virmani sir was rightly pointing out, the trend is shifting uh, towards a personalized medicine, and AI can help in enabling that. So we will see what are the progression and what are the approvals for devices in AI space, especially for cardiac imaging. So the agenda for my presentation is 15 to 20-minute presentation will be introduction of artificial intelligence in layman's language, what is actually artificial intelligence. And then there are subset of artificial intelligence like machine learning and deep learning. And then use of AI in medicine, deep medicine we call it, or precision medicine also the term is. Then some use cases of AI in imaging, especially in cardiovascular imaging, AI in cardiac imaging in heart failure. Recently, a paper was published in Nature regarding that. And one more paper was published in Nature regarding AI use in COVID-19 management. And as a AI assisted clinical decision support system. Then there will be conclusion and take home message. So first, what is artificial intelligence? The question, can a machine think? This question is not new. And this question was posed by Alan Turing in 1915. But this AI has lot of its relevance has increased in last 15 years because of increased computing power, falling hardware cost, and actually interdisciplinary knowledge sharing also one of the thing is, and then proliferation of data in last decade. And so we are saying right now that AI and ML has arrived in medicine up to some level, and there are some approvals also coming in that. AI enables a machine to think, that is without any human intervention. The machine will be able to take its own decision, and that is a dream, but some progress is being done in that direction. AI has many possible applications in retail manufacturing and healthcare. In retail and manufacturing, the AI and ML use is matured, but in healthcare it is new, and there are reasons behind that also. AI can solve the problem of availability, affordability, and quality in healthcare. That's why it is being termed as one of the panacea for healthcare. So the question is, where have we reached? So we will address that question, but before that, we will try to understand, because these terms are very confusing. We sometimes use term like this decision science, then someone say artificial intelligence, then someone says machine learning, then someone says deep learning, even some people call deep medicine. So these terms are like decision science is a universal set, and out of that there is artificial intelligence, and the artificial intelligence subset is machine learning. And in machine learning, where artificial neural network is done for feature extraction and image analysis, that is the deep learning portion. So all these terms are being interchangeably used. So that create confusion, but these are almost the same. So these are the difference between actually decision science, artificial intelligence, machine learning, and deep learning. Type of artificial intelligence system, there are three levels. One is artificial narrow intelligence. Artificial narrow intelligence is also called weak artificial intelligence. And this is the only type of AI that exists in this world today, not only in healthcare, but also in retail or manufacturing, where use of AI is matured up to certain level. Narrow AI is goal oriented and programmed to perform a single type many times. Like we must be familiar with, like Siri is there, or autopilot in airplane, or chatbot when you actually interact with a bank through a online platform. Then chatbots are there. These are all example of artificial narrow intelligence. Then there is artificial general intelligence, which is called strong AI, and this strong AI is actually concept in which machine exhibits human intelligence. So using strong AI, we can have ability to build machines that can think, strategize, and perform multiple tasks under uncertain conditions. So up to some level, artificial general intelligence level, we have reached in manufacturing and retail, but not in healthcare. Artificial super intelligence is hypothetical. We have, though there are movies like Robo 2.0, Terminator, those kind of intelligence is actually artificial super intelligence, and that is a rare dream. Now, in retail and manufacturing, we are at, in 2006, we were at machine intelligence level or general intelligence level. But in healthcare, we are still at machine learning level, which is stage 1, peak intelligence. Then what is machine learning? Although I explained in a slide, machine learning is a subset of artificial intelligence, and machine learning is actually we train a machine through algorithm to build systems that have ability to automatically learn and improve from experiences without being explicitly programmed. Most of us, you have used machine learning on day to day, like in Netflix, there is recommendation system, or in YouTube, there is recommendation system. Those kind of intelligence is machine learning based. In machine learning, we train the algorithm by providing it with a lot of data. And here, actually, the data is now available readily. Plethora of devices are interconnected devices are there, which are actually generating data. That's why machine learning algorithms are being trained and are being effective also. So ML algorithm can broadly classified into 3 subcategories: supervised, unsupervised, and reinforcement learning. Supervised, we are already familiar about. This is called actually white box algorithm. And unsupervised is have more potential, means as Virvani sir was talking about clustering pre-adaptive into 6 clusters. So actually machine can classify, means you give them data and they will be able to use unsupervised learning to classify into different clusters. That kind of possibilities are there. So there are black box. Black box are actually unsupervised learning based, and then there is white box, which is supervised learning based, and then there is reinforcement learning also, which I'm going to explain in next slide. Then in supervised learning, we have input variables and output variables, and we can use an algorithm to learn the mapping from input to output. So on some data, you actually train your algorithm, and then it is tested on some portion of data, and then it predicts. And supervised learning is used when we do not have labeled data. And here the opportunity is actually it can identify patterns. So that is unsupervised learning or black box machine learning. Then there is reinforcement learning, this type of machine learning algorithm in which an agent learns from interactive environment in a trial and error way by continuously using feedback from previous action and experience. So here we will use reward and punishment to train a machine. So this is reinforcement learning. These are certain types. I will briefly go through this. So machine learning, supervised machine learning, unsupervised machine learning, semi-supervised, and reinforcement learning is there, and they can perform different type of tasks like regression. They can perform classification, clustering, or association. So these type of problems can be solved using these machine learning algorithms. Different type of methods which are used in machine learning. So for classification, we have support vector machine, discriminant analysis, Bayesian nearest k-mean nearest neighbor is there. Then for regression, we have support vector regression. Then ensemble methods are there, decision tree is there, and of course neural network is there. Neural network can be used for classification also. Then in unsupervised learning, we generally perform clustering kind of problems. K-mean clustering can be used, then hierarchical clustering is used, Gaussian mixture, and then hidden Markov model, and of course ANN is also used in unsupervised learning. So this is a summary of different type of algorithm used, but there are many more algorithms which can be used for solving the problems like classification, prediction, or so. Now the third is AI, and then machine learning was subset of AI, and then there is deep learning. Deep learning is a machine learning technique that is inspired by the way human brain filters information. That's why it is called artificial neural network. It helps a computer model to filter the input through various layers which are interconnected. Deep learning processes information in similar manner as human brain done. That's why it can be used in application that people generally do. It is a key technology behind driverless car, or in medical imaging also. In radiology, we are using deep learning for image classification and pattern recognition in images. So most of the deep learning methods use ANN, as I told, neural network architecture. So they are often referred as a deep neural network also, and its application in medicine is called deep medicine. Type of learning, there are deep learning, there are 3 types of neural network: convolutional neural network, recurrent neural network, and recursive neural network. And in CNN, it is a deep learning algorithm that takes the input images and assign weights biases to various aspects of object in an image. So it can identify some pattern in an image, which is available for means disease person. So that kind of problem can be solved using convolutional neural network. The hidden layers of CNN typically consist of convolutional layer, pooling layer, fully connected layer, and normalization layer. Then there are recurrent neural network. Recurrent neural network are the where these are used to solve those problems in some tasks. For every element of sequence, the same task is being repeated. Then for that, recurrent neural network is helpful. And then there is recursive neural network. So these are 3 types of neural network, and the use of neural network is very much there in medical imaging, and in future it will be there also, and lot of opportunities are there. So AI is first foray into healthcare. Of course, we call that doctors are conservative bunch, but for good reason, and slow to adopt new technologies also. These are, but these are certain area where actually AI has arrived, like robotic surgery, image analysis, and clinical decision support system, virtual nursing, medical administration. Of course, risk is there a little bit less. That's why their adaptation is there. Genetic analysis, pathology, mental health, and drug discovery. These are certain area, and I will use discuss 2 cases, one on image analysis and one on clinical decision support system. Use of image analysis in detection of heart failure, and then clinical decision support system in case of heart failure only, and then we will discuss a case of use of AI in COVID-19. So this was the paper recently published in December 2020, and they say that in the fields like, and this actually review and discuss the state of artificial intelligence based on FDA approved medical devices, because promise is very much there, but in reality there are only 29 devices which are actually given FDA approval, and we will see in which area these approval came. So the first approval was in 2016, and one more thing was there. IBM launched their Watson tool, and they in 2010, and they were very much confident that they will be able to run OPD using that, but that was distant dream, and it has not progressed much. So this in 2016, as I was saying also, this was the first companies for which actually FDA approval come. Arteris is there, and the method was deep learning, and of course the main specialty was radiology and medicals related to cardiology. And here we are using deep learning for image analysis or classification of images. There are certain others also then came, like in neurology field, radiology field, ophthalmology field, the use of and then radiology, endocrinology. One Gaussian Connect system has Medtronics. They are predicting glucose changes. For that, they have used artificial intelligence. And similar there. What is common here? Medical imaging is the field where actually AI has arrived, and many studies are being done, and many devices are actually FDA approved also. So most of here, the radiology is the main specialty where AI applications are FDA approved. Then here also, in this case also, EcoBrain is there, and then CM Triage is there, then CM Triage in radiology. So here, these all devices which are approved are in either medical imaging or in solving some prediction problem or class. So these are actually list of 29 devices based on AI, which are actually approved by FDA. And this number has increased. And in 2020, there are two, and we are expecting that in near future, there many more will be there. So what is there, what this image suggests, the cardiology and radiology are the two fields where we are seeing the increased use of artificial intelligence in medical image analysis and classification or pattern detection in an image. Okay, so their cardiology and radiology are two areas where AI is actually slowly making its presence felt, and in future it will be there. So what uh, the question is, AI in medical imaging has arrived? My answer is, of course, yes. The algorithm in deep learning has much improved. There is increased shortage of healthcare professionals with increased burden of chronic care is there. Computing and storage cost has decreased significantly. AI has lower error rate than humans in image analysis that I will discuss with a particular case. This is not a general statement, but in some cases, AI has lower error rate than human in image analysis. AI usage has increased in sector like retail, banking, and manufacturing, and from there we can learn. And that's why healthcare can learn from other sectors, and the learning curve will be less, and healthcare has low risk of adoption also. So when we talk about AI in medical imaging, this I will skip. There is CAGR year by year growth rate of 45% in AI in medical imaging market, and market participant expected to collaborate with the research institute and healthcare provider to develop new AI based system. And in healthcare management courses also, where we teach, actually there is increased demand of healthcare analytics, which is where we teach artificial intelligence and neural network in that. So 5-year view, from processing to assessment to scaling up and then customized benefit. This will be the progression of use of AI in medical. And then we will be having personalized risk assessment and tailored management plan from patients, as Dr. Virmani was talking about, and that is possible. And in future, we will be able to figure out many hidden patterns in medical, not only images, in other areas also. So steps of use of AI in imaging, data features are there. Which type of features are there? Like edges, shapes, color, brightness, volume, 2D and 3D formation, embedded metadata, medical records you can analyze, then patient lifestyle activity and diet data is there. Then there are biobanks and bioresources and related to genomics also. The computing techniques which we can use are supervised, unsupervised, and combined tool. As I was talking about, supervised is white box, unsupervised is black box kind of thing. And main function can be done is cluster analysis. And as doctor was talking earlier also, so combined tool, unsupervised and unsupervised learning can be used also, or we can use many techniques together to find out better results. So ensemble and boosting type of technique. So imaging application of AI are like automated measure image quality, image sorting, red flag images, decision support and diagnosis, and then risk prediction for therapy like ischemia and all. So these are that I have already explained. Raw data is there, then we can process that data, and then we can use different clustering techniques, which are actually black box AI. And then methods can be used like hierarchical clustering, k-mean clustering, or model-based clustering, and we can divide the patient data into different cluster, and then we can personalize our treatment plan accordingly. These are the literatures which I was able to find out. There are increased use of clustering in cardiac imaging. So different clustering techniques are being used, like Hernandez et al. They have used the hierarchical clustering for left ventricle function, and their result was that the 3 cluster significantly different echocardiographic phenotype of type 2 diabetes mellitus. And similarly, there are many use of AI techniques, clustering techniques in case of cardiac imaging, and their results are also given. So one thing is sure, two area where actually AI has arrived is, one is medical imaging and another is your decision support system, where actually AI can assist a doctor in their decision making. And in healthcare administration, this AI is already there. It was there. So prediction of obstructive stenosis is there. And here we can actually extract features using convolutional neural network. And then there is a layer. And because we are using here artificial network, that's neural network, that's why we are saying it is a deep learning. And from deep learning, we can find out scores for LAD, LCX, and RCA, and then we can find out the patient score. So that is one of the use of artificial neural network, ANN and CNN, in actually cardiac imaging. There are certain, this was the first AI-based device which were actually approved by FDA. So they actually offer solution like cardiac, not only cardio AI, they are chest AI also, neuro AI, and lung AI also. And they have different features of cardio AIR, let's say 2D and 4D flow, and there are many other. What is the strength of this type of devices in number? They enables a faster exam up to 30%. This is based on a study. In LV and RV function segmentation can save up to 25 minutes. That is very good number considering the shortage of doctors. And it is as accurate as 7 experts. So human errors can be actually eliminated. It is not going to replace doctors, but of course it can raise flags when there are human errors. So that kind of thing is already being done. Then there is Bay Labs echocardiograph, EF determination. This is another application, AI based, deep learning based application, which was approved in 2018. And then there is one article published in actually December 2020, artificial intelligence for diagnosis of heart failure. So this study actually talks about that there is a really benefit of AI or hybrid approach. Actually, human intelligence and artificial intelligence hybrid approach is much better than only human approach or machine approach, that we will see. So AI for diagnosis of heart failure, why it is useful? Because the prevalence of heart failure has been increasing. Need not to say, heart failure is associated with high morbidity and mortality. Of course it is. HF is actually, heart failure is complex syndrome that can result from structural and functional cardiac disorder rather than a single disease entry. Correct diagnosis of heart failure can be challenging even for a specialist have a lot of years of experience. Clinical decision support system is a health information technology that assists physician in a clinical decision making. Earlier it was being used in healthcare administration also, but now it can assist a physician in clinical decision making. An effective clinical decision support system match the individual patient characteristics to the clinical knowledge base. Data is there. Provide patient-centric assessment, means precision medicine kind of thing, and a recommendation based on that. So this is in their study, they propose like one approach, which is existing traditional approach, is expert-driven knowledge acquisition is there, and then knowledge transformation is there, and they are having a clinical decision support system, which is actually based on human intelligence only. And then there is a proposed approach in which there we are having hybrid knowledge, not only expert driven knowledge acquisition, but also data driven knowledge acquisition. And on the basis of there, and we are also using AI assisted clinical decision support system. And they used, and the study what suggested about accuracies of various approaches in retrospective cohort. If accuracy is good, that is not a big thing, but in prospective cohort, if it is, then it is good thing. What were the result in reduced ejection fraction, and HF, MREF, and preserve ejection fraction heart failure. So these are the expert-driven clinical decision support system. The accuracy was for HF-REF, it was 100%. So it was for all three, it was 100%. For preserved ejection fraction, it was 82% for expert-driven. And for hybrid, of course, you see the hybrid, even for machine learning driven or AI based, it is 78.9, but for hybrid, it is improved 99.5. And for classifying it into not a heart failure, in that case also see the hybrid CDSS accuracy is more. And overall also the hybrid CDSS 98.3. So this paper actually recommends not only a hybrid CDSS approach for actually classification of heart failure into different category. What about then prospective cohort? Here the difference is very starking. The physician, the overall actually accuracy was 76.3, but AI assisted clinical decision support system, where we are using hybrid approach, for that accuracy was 97.9, and this difference is very high. It is 22% around. So that's why we are saying in diagnostic accuracy of physician and AI assisted clinical decision support system is actually very high. Then the next and last thing is where the application of actually artificial intelligence in COVID-19. So this was again a paper published, recent paper published in 2020. They talk about that application of AI in COVID-19 is in early detection and diagnosis of infection using CT or image analysis. Of course, I have talked about it earlier also, that there is increased use of AI, especially deep learning in medical image analysis. So that can be used in early detection of and diagnosis of infection. And monitoring and treatment also, ANN is very helpful. Contract tracing can be done and alarm can be raised on basis of AI, and Arog Setu, we're having some use of AI, but it can use more advanced actually AI models to actually for doing contract tracing and raising the flags. Projection and cases of mortality, ANN based forecasting tool can be used, which can be used for policymakers. Development of drug and medicine, AI has increased use in drug design, chemical synthesis, drug screening, polypharmacology, or drug repurposing. So there is increased use of AI in actually drug discovery also. Actually, it need not to say that it reduces the workload of healthcare professional, and healthcare resources are scarce. Prevention of disease by identifying the risk, actually that comes under contract tracing part only. So prevention of these are certain use of application of AI in COVID-19, and what they proposed that two type of approaches are there. One conventional approach is there, where physician analyze the symptom. If multiple matches are found, then test is taken. If no multiple matches were found, then no test was taken. Patient get quarantine, symptom treatment started, recovery phase, then this test for COVID-19, and if it is positive, then isolation. If negative, then cure. AI assisted, here physician identify the possible match of COVID-19 system with AI support. So here the error is also less, and effort for a human is also less. Sample taken to confirm infection and decide further therapy. Patient get quarantined and admitted. Start AI-based treatment and monitoring. Here also AI is coming for our rescue. Recovery phase, then retest of COVID-19, and again there is positive, then isolation, and if it is negative, then it is cured. So after this 20 minutes of discussion, what are the take-home messages? AI in medicine is going to play a major role in future, at least in medical imaging. And what is driving AI role in healthcare? Lot of wearable devices healthcare devices, portable healthcare devices, connected devices, which actually we call Internet of Things because the devices are interconnected, driving the transformation of healthcare, and it is being termed healthcare 4.0. In other area, in other digitalization in retail and other, we are talking about industry 5.0. Though healthcare is digitalization deficit, healthcare 4.0 has up to some level arrived. AI can help solving problem of human resource shortage in healthcare. We talked about in this case, in COVID-19 case and image analysis case also. AI has arrived in some of the area like medical imaging. Of course, I have talked about that. Future of cardiac care is AI assisted clinical decision support system. We discussed a case using heart failure classification. These algorithms are as good as data used to train them. That is the main area. If there is garbage in, there will be garbage out. If you have trained a model based on bogus data or garbage data, when you will do the prediction, that will also be garbage. So need not, here the precaution is needed. There are infrastructural and policy bottleneck to realize the potential of AI in healthcare. And there are need of trained resources also in who can actually think about the possible use of AI in healthcare. Data security and privacy is the major concern need to be addressed by the policy maker, not like the case of telemedicine during COVID-19 on 25th March, the government in hurry, they actually proposed telemedicine guideline. That type of measures should not be taken. Thought should be put, and there should be proper guidelines for data security and privacy concern in case of AI. So what I propose is a TIPG framework. Actually, technology is already there. We need to borrow it from other sectors like retail and manufacturing, and we can use in healthcare. Infrastructure is also there up to some level, but where we are lacking for realizing the potential of AI in healthcare is policy and governance. Policy to train people for use of AI in healthcare, governance to think about, to make guidelines for data security and privacy concern. So a lot of need to be done, but we can say one thing, AI in healthcare, at least in medical imaging, has arrived.